be
Okay.
one and the same, because intradiscal and hydrostatic, the most of the water is in the nucleus.
One of the reasons why I'm going to cover all this stuff is because we always tell everyone, telling you guys that we're better than everybody else. We're better and we're the best. Yeah. A lot of people say they're the best. Nobody says that we're the worst physiotherapy or chiropractic office in the world. You call around KL, every chiropractic office will tell you we're the best. Okay, so patients get confused. Patients, no, just like going to a restaurant. I've gone to restaurants and I've asked what is good on the menu. Sir, everything is good. But everything can't be good. And everyone can't be great. There's some good, some great, and some mediocre, and some horrible. It's in every menu in every restaurant. And also when you look at the physiotherapy and chiropractic world, it is in every clinic. In every clinic there are good people and there are bad people. Some clinics have a lot more bad physiotherapists and chiropractors than good ones. And those are the ones that are bad chiropractic or physiotherapy offices. And the ones that are really good, the ones that can say that we are the best, they have no bad physiotherapists and there are no bad chiropractors. All of their staff is good. They're knowledgeable, they're skillful, and that is what makes them good. And that is the whole focus of our trainings. The reason why you guys go through this is to become not just good, to become great, because we say our center is the best. You cannot be the best if you're good. You have to be great to be the best. Okay? You went to school, all of you went to school. You got your degrees, your diplomas. That gives you the right to call yourself a chiropractor or a physiotherapist. There's a whole bunch of people that graduated with you. Okay? Some of the people in your class will go on to be great therapists. Some will be horrible. Some will be so bad that they will leave the entire physiotherapy or chiropractic field. They don't want to ever do it anymore because they were not good at it or they hated it. And some will be good or mediocre. Okay. The difference between these guys or these people is what they did with the knowledge that they graduated with. Some stop learning at point of graduation. Others continue to learn more and more as they practice. The more you learn, the better you get. Okay. Brain develops from the time you're pretty much from the time of conception. Nerve roots develop, brain cells develop. They say by the time you're 2 years old, you'll have the exact same amount of brain cells that you will have or that you will possess when you're an adult. Did you know that? You have to say, but they say by the time you're age 2, 24 months, at 24 months of age, you're still walking around in diapers, you will have all the brain cells you will need for the rest of your life. You will not get any more brain cells. Did you know that? The amount of brain cells you have now is possibly less than the ones that you had when you were 2 years old. But alcohol, stress, deprivation, whatever has killed some brain cells. But at 24 months, you've had more brain cells. Why are we smarter now than we were when we were 2 years old? Do you know why? Connections between brain cells. It's not necessarily the number of brain cells. It's the connections between each cell. That is how intelligence is defined. So, you have the set number of brain cells. You go through school, you go through life. School helps you build bridges and highways, communication pathways between the brain cells. Every experience you go through life, you will develop a little bridge, a little communication pathway. And that is what increases intelligence and knowledge and skills. In other words, by the time you go through school, you graduate, you develop more and more communications between your brain cells. Okay? And your knowledge is expanding. And you're able to connect this one to something else. You can connect this one to something else. Next thing you know, you can reason things out or hypothesize things, this is what scientists do, that no one else has ever thought of. Einstein, E equals MC squared. Why? Because of all of the knowledge that he had gained, connected, made bridges between his brain cells, and using all of them at the same time, he was able to hypothesize this. He did not physically see it, he hypothesized it. So knowledge allowed him to do that. And that's what knowledge is helpful for. You gain some in school, you develop connections. You can develop more connections. Now connecting the connections and connecting the brain cells, The more connections you develop, the better you will be. This is why we go through trainings. The trainings will be finished here soon. Next week you guys are done. But it doesn't mean that you're done completely. You still have to keep on learning. Keep on reading. You will have the manuals in your offices. You have to use them. You have the internet. You have to use them. And I also require every physiotherapist to give me a paper once a month. Research an article. We will give you an article. You have to do that. The reason for all of these things is to help you grow. I don't want you guys to be mediocre. I don't want you to be average therapist or average chiropractor. No. We want to be the best. To be the best, we have to do things. You will be uncomfortable doing it now. I guarantee you will not like it. I will push you. I'll say, I need a paper from you and I need you to do this. This is why you guys are writing paper this way. We need them to educate our public, our patients, the people that come to us for treatment. But also, it's not just for them. But more importantly, it's for us. For you to write a paper, you have to go on the internet and research a little bit. And when you do that, guess what happens? You're learning. You're learning, you're reading, you're learning, and then you're taking that information, converting it into your own words, and rewriting it. That's comprehension. That's getting knowledge. And every time you give me a paper, every time I ask you for a paper, you're not going to get all the communication on me. Okay? But it's going to it will make you grow. And in time, in a matter of months and years, you will notice the benefits. One day you will wake up, you can connect things with you. Wow, this is why I need to do this. This is why we should do this. This stuff that we're doing is no longer effective. The reason why I tell you this is because I had that happen to me. I kept on reading. I had a personal motivation. Severe back pain to the point I couldn't go to the bathroom. And when I crawled myself into there, I couldn't use the toilet. So after that was the lowest point in my life. I will never forget that. And here you are 24, I was thinking that I was going to be paralyzed the rest of my life. And it was going to take care of me. I can't even get up and sit on the toilet seat. But that's a bad point. So I started reading more about disc, about how disc is damaged, And one day, out of nowhere, I need to do this. One of the research I don't know exactly which point, but one day I got up, I said, no, what I'm doing is wrong. What I've been taught is wrong, it's not effective. In chiropractic, Doc can tell you, and I don't know if they're still teaching it this way too, Dr. James can teach this. They talk about subluxation. I was taught everything is a subluxation. And do you know what a subluxation is? Subluxation. Have you ever heard that term? Have I said that term before to you?
I think she was trying to give you a definition.
Yeah, no, I'm gonna get it from her. Oh, I like the color. What is a subluxation?
I was taught that this is a stage before you go to these locations. It's a separation between the bone.
Correct, yes. Subluxation, anyone else? That's a medical term with the definition for subluxation. But this term was first used by chiropractors, not by radiologists, not by orthopedic surgeons, not by the medical doctors. They laughed at this term. Now they're using it. But chiropractors, the first chiropractor that used this, D.D. Palmer, in 1895. He defined this. He said subluxation is a minor misalignment. You can write this down. Of spinal bones. That leads nerve irritation and an eventual loss of health. That is, from what I know, the shortest and most descriptive definition of subluxation as it was intended by the person who coined this term in 1895. But the medical definition now is one less than a dislocation. It's not a dislocation, it's almost a dislocation. The joint has separated, but it has not dislocated. is minor separation or minor dislocation. Subluxation. Okay, that's what but this is what we were taught. What I was taught was that this is what happens. Okay? Which is fine. This is not bad. This is actually great if you live in 1895. Okay? It's still correct to say that, but there's a lot of things between here, misalignments of spinal bones, and your nerve root irritation. And then there's more spaces between here. Now, stages from here to here, to here to here, from here to here were not defined. It was hard. He hypothesized this. And he's correct, yes. It's not that he's wrong, but there's a lot of things that was not described to me. And I couldn't understand it for a very long time. I had a problem. It's not that I don't like this. I don't like the way it's being used. Excuse me, let me shut my phone. Sorry. I mean, it's not that I don't believe in this term. Yes, it's there. It exists. It's not religion. It's a definition. But I don't like the way it's being used. Okay? And you guys need to understand that. When you understand what happens in here, then you can understand why you're doing the therapies you're doing. And when you understand also what is happening to a patient from stage to stage, not just calling it you have a weakness in your muscles, you have a bone that is malpositioned, you have trigger point, you have tight muscles. Okay. These are simple things. They're not descriptive. You need to understand what happened that led to those things. Once you know what happened, what was the cause of that trigger point? What was the cause of the muscle spasm? Why did the disc herniate? How did it herniate? Then you can do the proper treatment for a person. Okay? Do you know what is the hardest thing in healthcare? When treating patients, what is the most difficult part of treating? No, before this, to treat a person, in order, for instance, let's say, Mr. Jones comes to your office, you examine him and all that. What is the most difficult part?
To gain confidence.
To get into where there's a problem.
Those aside from that, that's the reasons why they choose the reality that they have to go to. I'm talking about the most important thing before you give a patient treatment. What is it? And the difficult thing, the most difficult thing too. What do you have to have before you treat anyone? What do you have to establish?
Patient prognosis.
No. Diagnosis. You cannot treat someone unless you have diagnosed them, correct? Otherwise, it'll be rub-a-dub-dub. We don't do rub-a-dub. We diagnose. We find out what's wrong with them. You can't treat someone unless you know what the problem is. How can you treat if you don't know the problem? You know what's also the most overlooked thing in healthcare? Diagnosis. Well, everyone is diagnosed now with algia, anitis, inflammation or pain. Nothing beyond that. Kappa, sciatica. That's not a diagnosis, that's a description. Radiculitis, not a diagnosis, a description of what's happening to you. You need to have a diagnosis. Yes, you may use the terms because insurance laws and regulations, again, you have to have these terms there, but you need to go a step deeper in that, at least in your mind, and explain that to your patient so they understand. Diagnosis is the most difficult part. The success of every treatment depends on the accuracy of your diagnosis. Okay? And what do you need to do? What do you need to possess in order to diagnose a patient? Come on. Knowledge. Okay? If your diagnosis, okay, let's say a patient comes to you with, in our case, the spinal disc herniation. And you diagnose this person with muscle spasm or subluxation. Okay? Are you wrong? No. They do have, usually people who have the slip disc, spinal herniation, they will have a muscle spasms. and they will have subluxation. So you can't say, technically speaking, I've done my diagnosis. Yes, you've done a cop-out diagnosis, a cheap diagnosis. You did not do your job fully. Your patient was ripped off, did not receive the benefit of the knowledge you should have. Because had you done your job right, you would have said the diagnosis is spinal disc herniation, protrusion, followed by this and this nerve and that would be a diagnosis. In other words, meaning what is the purpose of diagnosis? The purpose of diagnosis is, one, the patient to know what's wrong with them. Okay. Two, the doctor knows what's happening to the patient, and that's more important. The doctor and therapist need to know. And all the supportive staff at the hospital or the clinic, wherever the diagnosis is done, needs to know. So they don't have to do the damn exam over and over if they're seen by 50 different people, or therapists, or 10 different people, or 5 or 2. They can just look at the diagnosis page. This is the diagnosis. I know what to do. If I just see patient with back pain, muscle spasm. Okay. What are you going to do with a muscle spasm?
Take 2 of these, call me tomorrow.
Aside from that, let's say you're a therapist. A medical doctor will give you muscle relaxers or put a little jab in your buttocks and then they'll send you on your way home. A physical therapist or a massage therapist will go rub it up done. Or centers that have a little bit more equipment, they will put a hot pack on you. Hot pack, they'll put electrical therapy. They may give you some muscle work. And then you're good to go, that's pretty much. And guess what? You had a slip disc. You had a disc herniation. Will this help you? Electrical therapy, maybe. Muscle work, perhaps, and it can also make you worse. Hot pack will definitely make you worse. Or make your patient worse. And they make him feel better. Hot feels good. Yo, this is so good, relaxing. Oh yeah. 20 minutes later, they get up, they go home. Tomorrow, they're in agonizing pain, they're flared up. Heat is the muscle relaxer. And the therapist did not make a mistake. The therapist did her job. Because she looked at the diagnosis, muscle spasm. For muscle spasm, you put hot on it. You do a little muscle work, maybe a little electrical stimulation, or continuous ultrasound, which also is contraindicated for a person with a slip disc. So you do the right treatments, but it's not for the right patient. It's like a person comes to you with heart problems, and then hypertension. He comes with hypertension. Goes to the GP for hypertension, but he gets antibiotics. Ludicrous, right? This is how ludicrous this is. It's laughable. So to avoid these things, you need to have exact diagnosis. The only way that you can have, or you can expect, 100% success rate is if your diagnosis is 100% correct. But it doesn't stop there. Do you guys understand that? Any questions so far? In order for you to have a success rate of 100% or very close to it, I actually let's say exactly 100% success rate, you will need to have a 100% accurate diagnosis that describes that patient's condition to the T. Correct? What else do you need? Anything else? It's not just 100% diagnosis. You have to have 100% diagnosis in order to get 100% success rate. But between 100% correct diagnosis and 100% success rate, there's also a few steps. And this, the most important, then comes your skills as a therapist or chiro. So every step you need to work on. And in order to go